Some help is on the way to Alberta right now. 8 Canadian Armed Forces critical care nurses and up to 20 Red Cross medical staff will arrive in the province to help alleviate that province's overwhelmed hospitals. Newfoundland and Labrador is also set to send 5 or 6 ICU-trained staff to Fort McMurray. But will these new fresh hands be enough to turn the tide against the fourth wave crashing down hard in Alberta? Or does the Kenney government need to bring in a firebreaker lockdown to set things right? Heather Smith is the president of the United Nurses of Alberta, the union that represents more than 30,000 registered nurses. And James Talbot is the former chief medical officer of health in Alberta. First of all, both of you, thank you for your frontline work, first of all and foremost, and thanks for joining us. Heather, I'll start with you. How bad is it there? Set the scene of what frontline workers are experiencing and what they need.
Well, today is an important day again, and there's a whole lot of trepidation. This conversation is happening before we get today's numbers, which we have not had any reporting on, of course, over the weekend, so we don't know Friday, Saturday, Sunday. I can tell you there is great fear. The exhaustion, the physical, emotional, psychological exhaustion is extreme. They're staffing critical care beds. It's not a bottomless pit, and many nurses in this province would tell you that in terms of their physical and emotional ability to continue to work, the well is dry. So it's very desperate. We're looking at opening up more temporary beds, so it's pretty desperate.
Dr. Talbot, obviously, it's good news that Canadian Armed Forces are going to be in the province to help, and the 8 critical care nurses. Is it remotely enough, or does something else have to happen?
No, it's not remotely enough. I mean, even if the measures the government has put in place are going to be effective, we're going to be looking at this pressure going on for at least another 4 weeks. And so, I mean, all Albertans are grateful for help during this crisis, but it's not remotely enough to get us through it.
Dr. Talbot, what is enough? Like, what needs to happen, in your view?
Well, we've sent a number of letters to the minister and to the premier indicating that we need a variety of things put in place because it is a crisis. We have more COVID circulating in the province than anywhere else. We have 13 times more per capita than Ontario has. We have fewer people immunized by about 10%. And we have this killing stress on the acute care system. So we would like them to start sending people to ICUs out of the province to take the pressure off the ICU nurses, the anesthetists, the respiratory techs, and the physicians. We'd like them to start getting serious about getting people immunized by moving to mandatory vaccine passports. We'd like them to be serious about getting employers who haven't to this point made it mandatory for their employees to get immunized to do so that they can protect their staff and they can protect their customers. And then we're asking for a limited fire break to start to interrupt the transmission in the community. Unless we get a selection of those things happening, this could go on for weeks or months.
And that lives are at stake. Heather, in your view, first of all, is the support you're getting enough? And if you were speaking to Premier Kenney, what do you think he needs to do?
Well, he needs to follow real public health requirements and calls for things like the circuit breaker or fire break. And 8 people, 20 people, 32 people, if you include the nurses coming from Newfoundland, it's nowhere near enough. Some would say a drop in the bucket, but every drop at this point helps and is essential. What I would say to Mr. Kenney directly is it's time to take action, not political, but health action for the people of this province.
And just finally, before I let you go, Dr. Talbot, do you feel in the next coming couple of weeks things, I know Heather said that you haven't seen the numbers of the last 24, 48 hours. Could things get worse, Doc?
Oh, for sure. The numbers were just updated before we went online. We continue to lose 15 Albertans a day, 100 a week. There is some sign that in Edmonton, Calgary, and Lethbridge, where the mayors have taken the kind of responsible steps that Heather just talked about, that the numbers are coming down slightly. But the time, as she also said, to act is now, because Albertans want to know how many Albertans are going to die if the government continues to do nothing. They want to know when they're going to be able to get back to having elective surgeries, and they want to know when the pressure is going to come off the very fine people who have put their lives and their mental and physical and spiritual health on the line for us over the past 18 months. They want to know when that stress is going to go back to normal. And so far, the Premier is refusing to engage in that discussion.
Well, both of you are doing exceptional work. I know all of the teams and the people you know. Heather Smith, frontline with the nurses, and Dr. James Talbot. Always a pleasure to have the two of you. Please take care, and thanks for your information and your time. Appreciate it.
Please stay safe. Thank you.
Please stay safe. Get the shot.